It's Monday, and welcome back to the Joust About Careers podcast for the first episode of 2024. This is a place to learn about careers from the people who are actually doing the work every day. I'm your host, Brian Brott, and my guest today is Abby Allen, a 2005 Van Buren graduate who is a physician's assistant and assistant professor in the PA program at the University of Findlay. Abby shares how a typical day looks for a PA and professor, gives advice on getting into PA school, explains how a PA is different from a nurse practitioner, and much more. Whether you are interested in a healthcare career or are still exploring your options, I hope that what Abby shares today will help all of you make better career decisions and have fulfilling career journeys. Enjoy the show. Welcome back to another episode of the Joust About Careers podcast. And today we have 2005 Van Buren graduate Abigail Allen with us. And she's going to be talking about her career as a physician's assistant and as an assistant professor in the physician's assistant program at the University of Findlay. So Abigail, I'll call you Abby from here on out. Great to have you with us, and I'd love for you to just start out by talking a little bit about what does a typical day look like for you, and I realize that you do a little bit of a couple things right now. So maybe right now, what does a typical day look like, and then what did a typical day look like when you were working as a physician's assistant full-time?
Okay. Well, first of all, thanks for having me. It's always exciting to promote the career and our program a little bit. So a couple things. Typical day for me, it really honestly varies from day to day at the university. So we, as far as our classes go, we kind of co-teach everything. So each of us teach to our specialty. So I don't necessarily teach class every day. But typical day for me, I come in, go through my emails, kind of review my calendar. If I have lecture that day, I'll be in class anywhere. Most of our lectures are on average an hour and a half to 2 hours, I would say. Sometimes we have a lab associated with it. Sometimes we don't. It's just straight lecture. And then I spend probably majority of my time prepping lectures. So just making sure medicine is ever changing. So making sure I have the most up-to-date medications and the most up-to-date guidelines, to make sure that I'm teaching the students the most appropriate evidence-based medicine that's out there right now. And then, writing exam questions, making sure my exams are set up is a lot of kind of my day to day. So like fall semester, I teach a class on how to do procedures. So I teach the students how to do things like give injections and start IVs and put in catheters and things like that. So then I have to spend a little bit of time setting up the mannequins, tearing down the mannequins, those types of things. But actually, as of Friday, we graduated a cohort. So I'm on break right now. So I get break until second week of January, which is kind of nice. So now's a little bit of a lull for us.
Yeah, that sounds very nice.
It is nice. It's the one bonus to working at the university, but the downside is our program goes all year round, so we don't get summer break. So I don't get a summer vacation like most, which would be awesome. But we do get 2 weeks at the end of summer, which is nice. But so, and then as far as working clinically, so I started my career in the emergency room at St. Rita's, and then I spent a little bit of time at Blanchard Valley in the ER. And then I worked at Blanchard Valley Medical Associates for a couple of years, and I did endocrinology and just general internal medicine. And then at the end, I was working residential care through Blanchard Valley Hospital. And I still do that on a PRN basis, which is an as needed basis. And we cover, so the physician that I work with now, Dr. Manuel, he covers Birch-Haven. And so I don't get to work there as much as I'd like. But I cover when he has a nurse practitioner right now. So whenever she takes vacation, they usually send me an email and say, hey, what shifts can you pick up? Depending on my class schedule, we are allotted 8 hours on Fridays to maintain clinical practice. So there are 2 people in my office that do work every Friday in allergy and asthma. I have the first 2 years or 3 years of being here, I kind of wanted to get established in this before I picked up more of a clinical role. So I still work there. I would say probably this year I've had maybe like 6 shifts. I do have some coming up in January. The nurse practitioner unfortunately put in her notice, so they asked me if I could help out in January. And I am actually actively looking for something on Fridays where I can start seeing patients again clinically. So, but at the nursing home, it's a little bit different than working in a doctor's office. So we're technically the family practice or the house doctor for the nursing home. It's a lot of paperwork, probably a lot more paperwork than people would realize, looking through labs and signing papers and, doing all of those medication reviews and things. And then typically I'll see a couple patients while I'm there, anywhere from, I don't know, 5 to 6, I'd say. I'm a little rusty because I don't do it all day, every day. So I don't see as many patients as I used to. And the paperwork takes me a long time.
Right.
But so that's kind of what my clinical practice looks like. And then I spend the rest of the day charting after I see my patients and again, going through the paperwork before I leave for the day.
So someone who's thinking about going into this career as a physician's assistant had better be ready for the paperwork. Now, you talk about reviewing a lot of it. How much writing is there when it comes to that paperwork?
It's not necessarily writing. Well, I guess if you consider the charting aspect of it, you're using the electronic medical records and doing charting. But so a lot of it is just like, here's your patient's labs. What do you want to do with them? So it's a lot of just me writing, keep the same or adjust this medication or recheck this lab in a couple of days. So it's not really that I'm like writing paragraphs. It's more just like a couple quick little notes here or there.
Okay. So you've talked about a doctor, you've talked about nurse practitioner. Obviously, you're a physician's assistant. I feel like there are so many different opportunities out there in the medical field. What's the difference between PA, nurse practitioner, and an MD?
We get asked this question a lot. It's kind of a tricky one to navigate. Okay, so to become a PA, you have to have an undergraduate degree. And then on average, most PA programs, so it's a master's degree. To become a physician assistant is a master's degree. Our program is 28 months. On average, they're 27 to 28 months. You're going to find some that are a little shorter. You're going to find some that are a little bit longer. And then when you graduate, you have a master's degree. While you're going to PA school, you will do, here we have 8 rotations, 7 core rotations, and then you get to do 1 elective rotation. And the nice thing about being a PA is that you can switch specialties as often as you would like to do. So for instance, I worked in the emergency room. I did a little bit of internal medicine. Then I did a little bit of geriatrics. Now I'm in education. So, you can switch specialties should you choose to do that, which is a nice thing about PA. If you wanted to become a physician, so, there's MDs, there's also DOs. For them, you also need a 4-year degree, and then you apply to medical school. Most medical school programs are a couple of years. And then once you get through medical school, then you apply for a residency. And so the residency is going to kind of funnel you into your area of specialty. So you may do a residency like in surgery or orthopedics or internal medicine or OBGYN or pediatrics. And then once they do that residency, which again is usually a couple of years, a lot of them will go on to do a fellowship, which is where they really become specialized. So let's say, for instance, you want to work in orthopedics, but you specifically want to do knees. So then they would go on to do a residency where they may kind of specialize in knees or foot and ankle or something like that. So medical school, honestly, from start to making it all the way through a fellowship could be anywhere upwards of like 10 to 12 years, depending. And the thing with medical school is once you're in your specialty, unless you wanted to go back and do another fellowship, you're kind of in that specialty. So you don't have that, versatility to be able to jump around like we have that ability. Plus, obviously, the years make a huge difference too. And then as far as nurse practitioners go, so there's a couple of differences between nurse practitioners and PAs, but really there's also a lot of similarities between the two of us. You'll hear a lot call us advanced practice providers as well. I don't know. There's a lot of different opinions out there going on right now about calling us mid-levels versus advanced practice versus just NPPA. I'm not going to get into the politics of it all. But so nurse practitioners, typically, they have to be a nurse first. So you go to nursing school. And then as far as NP school goes, there are a lot of online NP programs. And then there are some in person. I feel like majority of the NPs that I know have done their NP online. And with that, then they also have to do clinical rotations. I can't really speak to exactly what that looks like because I don't know the numbers and stuff. But what I do know is they do have to specialize in area. So they either have to pick like adult medicine or pediatric medicine. I think it's like adult medicine, family medicine, or that seems about how it works out. So they do kind of have to specialize a little bit, where we get training across the whole spectrum of age, birth to death. We get that training. And then with the nurse practitioners, still same idea. They can still write prescriptions. They can still see patients. In some states, they don't necessarily have to work under a supervising or collaborating physician, whereas PAs, typically in most states, we do have to work under a supervising or collaborating physician. Another big difference between nurse practitioners and PAs, if you listen, like the old school kind of thought processes, we're more medically trained. So we kind of follow the medical board, which is where our physicians come from. And then nurse practitioners are more nursing trained. So they have more of a nursing background, and their overseeing board is the nursing board. So we have different boards that kind of are over us and govern us.
That's
but
interesting.
We still do a lot of the same things.
Right. And just the flexibility. And how did you decide to do PA and not medical doctor, not nurse practitioner? What made physician's assistant right for you?
So it's kind of a funny story. I don't know that it's a great story, but I actually started college out to be a Spanish teacher. Mrs. McIntosh, Senora, was kind of my influence. I was going to be a Spanish teacher, and I did that for 3 years. And then I had a couple of injuries. I was doing track in college, had a couple of injuries. And I had this friend. I was actually switching to exercise science because I wanted to own a gym. I was going to be a personal trainer and own a gym and go that route. And I had this friend in college who she was one of those friends who would never go anywhere by herself. And they had a career night at Wright State. And she's like, come with me, come with me, come with me. And, I went with her and they talked about PA. And afterwards, I called my mom and I was like, Mom, this is kind of cool. And she's like, yeah, you should totally do that. So it was literally Spanish education on Friday. And on Monday, I was in my academic advisor's office figuring out how in a year and a half I could graduate with an exercise science degree and apply to master's school. So there really wasn't a lot of thought that went into it. But I will say to get into PA school is incredibly and extremely competitive. So my backup plan, had I not gotten in, was Wright State had an accelerated 2-year nursing program. So had I not gotten in, my backup plan was I was going to go on to be a nurse. And then who knows, potentially could have ended up as a nurse practitioner. I don't know what that would have happened. Medical school was never on the table. Okay. I was not willing to spend and dedicate that many years of my life. Plus, I was already way behind because I had been a Spanish major for 3 years. So
Right. And I can assume that any of the PA professors at the University of Findlay, they all probably worked as PAs for a time before they started teaching. No one goes probably straight from PA school to being a professor.
No, kind of the general rule of thumb is they want you to have about 5 years of clinical experience. Obviously there are some places where that doesn't always pan out, but ideally they want you to have at least 5 years of clinical experience before you can get into teaching.
Okay. Was it difficult to get those credits to move from Spanish education to exercise science? Was there quite a bit of overlap where it wasn't that big of a deal to make that change 3 years into college?
There was no overlap.
Okay.
My gen eds, yes, my gen eds overlapped. But so I think it was, we were on quarters at the time at Wright State. So I think it was fall quarter. I decided to make the switch of my 3rd year. And then I basically took 18 plus credit hours spring, summer, fall, spring, summer, fall, spring, just to get everything in. And so I was taking, chemistry 101, A block 4 weeks in the summer, and then B block 4 weeks in the summer. So accelerated 8 hours a day of chemistry. And it was kind of crazy, but it all worked out.
How was that with, I'm guessing Spanish education, you didn't have to take a bunch of high level science classes. You hadn't probably taken any of those since high school. Was it difficult to pick that back up, or was a lot of it came back to you fairly quickly and it wasn't too bad?
Yes and no. I was really fortunate that I learned really high quality studying skills in high school. I was never really one where everything just came super duper easy to me. So I knew how to study. And I was also really fortunate that I met a really great group of core friends. Actually, most of them ended up becoming physical therapists or went to medical school. And so we kind of, became a study group, which was nice. And I was able to, have people to study with, and it came back pretty quickly, I would say. Plus, the other thing too is, like some of those classes like anatomy and physiology, I was loving it. So I was thriving because I wanted to learn it and it was interesting and I didn't mind studying. It wasn't like pulling my teeth out trying to write a 1,000-page paper in Spanish, and trying to translate everything. Like, this was stuff I wanted to learn and it was really cool and I enjoyed it. So it made it a lot less difficult just because of that.
Right. So as you think about being a PA, what are some of the best parts about that career?
Obviously helping people, when you have those patients that you make a difference in their life, that's by far one of the best aspects of it's why we do what we do. And then now shifting into education. So we just graduated a cohort on Friday and it's so awesome. We always joke with them. We aren't Facebook friends until they graduate. Once they graduate, we're allowed to be Facebook friends. And just watching them like develop and, move into their careers, because, when I was working clinically, I could help one patient at a time. But now that I'm in education, theoretically, we have cohorts of anywhere from 19 to 24. So I'm touching 19 to 24 lives at a time because those students are then going off and it's kind of that ripple effect. So that's really cool. I enjoy getting to know the students and getting to teach, the next generation of our profession. Depending on where you work, the flexibility can be kind of nice. The schedule can be kind of nice. So here, for instance, it's very flexible with having kids and a family. And then, so my husband, he's a PA also, he works in orthopedics. So his schedule is a little bit more demanding at times. He works more of your 8 to 5, plus he takes call. He has to go in at night and on the weekends and things like that. My job was always mostly Monday through Friday, 8 to 5 office type of thing. Obviously the benefit, it pays well. Being a PA has, a decent average salary. So that is helpful too. But I would say those are probably the biggest, bonuses of it, is helping people, being there, helping people.
How much demand is there right now in the medical field and specifically for PAs? I mean, you said you graduated, 19 to 24, are hospitals saying we need 50 to 100, or what's the demand look like?
I don't know that I can speak on specific numbers, but I can say that since I've been here, so I started in January of 2020. Since I've been here, I'm pretty sure almost 100% of our graduates have gotten jobs, I would say, within 3 to 6 months of graduation. If not, to be honest with you, our cohort that we just graduated on Friday, I can think of at least 10 of them off the top of my head who already have signed contracts before they even graduated on Friday. So our students are not having any difficulty finding jobs. Now, with that being said, it's not always exactly what they want right out the gate. But our students are not having any difficulty finding jobs.
You had an exercise science undergrad. Are there any specific undergrad programs that would be especially conducive to someone becoming a physician's assistant?
So I don't know about all of the programs in Ohio, but I know a couple of them, like Kettering used to have, or maybe still has, a 3+2. So you do 3 years of undergrad and then it's combined with 2 years of the master's. So like the last year of undergrad, the first year of master's are kind of interwoven. But what I always tell students when I go and speak for like career days and things like that is get an undergraduate degree in something that you want to do for a living. So for instance, if we're getting 500 applications for our program annually, I don't know what our average was this year, but prior to this year, we were getting around 500 to 700 applications a year.
Wow.
Of those applications, we're only interviewing around 100 people who actually meet our requirements. Their applications are what we're looking for. And then it's only 24 spots. So the likelihood of getting in is not very high. So get a degree in something that you want to do for a living. Not that having a biology degree or a chemistry degree is a bad thing. I think it's fantastic if you have a plan to do something with that. So I always tell students, consider things like getting a sonography degree or a radiology tech degree or a nursing degree or exercise science or athletic training, something that you have a backup plan, you have something to fall on just in case you weren't able to get in. So that's kind of what I usually tell people.
Right. I did not realize it was that competitive to get
really
in.
Competitive. Yeah. Now there are PA programs popping up everywhere. So when I graduated, I think in Ohio, there were maybe 10 or 12. And I think now we're up to 15 to 17. Like it's rapidly growing.
Right.
But yeah, I mean, we still want the best of the best because at the end they have to take a huge certification exam. And, we want them we want to have good, PAs that we're training. So
right. And I mean, I want a good PA who is providing medical care to me and so forth.
Of course.
If someone applies to Findlay, doesn't get accepted that first year, is it typical for people to apply again the next year? Do most people go to other schools, or do they give up on that dream, or is there a general way that typically plays out?
It's a little bit of a loaded question. So it really depends on why they didn't get in. So different programs have different admission requirements. I would say for the most part, most programs have the standard prerequisite courses that you have to take. So biology, chemistry, anatomy, physiology, psychology, medical terminology, we all kind of have pretty standard similarities for those prerequisite courses. We do not require patient care hours, but we do offer almost kind of like a little bit of a bonus point if our applicants have patient care hours. So a lot of times students will, for instance, let's say maybe in those prerequisites, they got a couple of C's. And so if they don't get in the first year, I've seen where some of them will go back and maybe retake a course to try to get an A in it to try to boost their application. Or I've seen where they will go and, get a job as a scribe or a pharmacy tech or an STNA at the hospital or the nursing home, just to try to get more patient care hours, more hands-on experience, and then apply again the next year. Okay. The nice, but maybe not so nice thing about applying to PA school is there is a centralized application. So it's called CASPA. Centralized application system, maybe for physician assistant. I might be what it stands for. I don't know what the S is. But it's kind of nice because you fill out one application and then you can just kind of click all of the buttons for the schools that you want to apply for. Now, with that being said, you have to know what are their prerequisites, and a lot of them charge a fee, so it's not just as easy as like click, and then, you have to write this check at the end, but it's kind of nice because you can apply to multiple programs at a time and your application kind of goes out to everybody.
Okay. So kind of like the Common App today for undergraduate degrees and colleges and so forth.
Same idea. And I filled out my CASPA application. Gosh, what would that have been 13 years ago now? And it was painful then. And our students coming in tell us it's still just as painful as it was then. It's tedious. It's very tedious.
Right. Well, and I think, again, you talked about how experience, people that get rejected that first time, maybe that's the thing they were lacking. They go out and get that. And again, I try to keep telling students, go get experience in whatever you can, just because it's going to tell you if you're going in the right direction. And then that's going to help, like you said, with those applications down the line and so forth. So
you'd be impressed how often we see applications that maybe they haven't done any shadowing. They haven't really worked clinically. And sometimes I find myself asking, does this person even know what a PA is or what a PA does? Right. Because it's a little, unnerving to know that you're applying and I'm not sure that you really grasp our career and what we do. So I think that that's great. Yeah, I know Blanchard Valley has something in place where students can apply for shadowing, or, sometimes you can just call some of the local offices and ask if they take people for shadowing. That's always a great idea too.
Right.
Another thing that I always tell high school students or students getting ready to start college is, because the application system is so intense and competitive, sometimes it's easy to kind of fall into, you get out of the house, you get away from mom and dad, you're going to college, you kind of don't get up and go to class maybe. And if you're thinking about a career in medicine, I mean, really not even PA, PT, OT, speech therapy, any of those competitive master's programs you're going to be potentially applying to, you have to have good grades. So, don't think that first semester of freshman year does not count, because we see that and it 100% counts. And I see a lot of people, unfortunately, who don't get offered seats into our program because, that freshman semester, and not that that's the only thing we weigh, but, we can see that. So right. You got to be prepared and get moving right off the bat.
Yeah, it all matters.
It does. It 100% matters. All of it.
Yeah. So as we wrap up and you think about your life experience, career experience, et cetera, is there anything that you've learned about life or careers that you know now that you wish you had known when you were back in high school?
I think the biggest thing for me is, I think it's interesting. I always knew I wanted to be a teacher. I think when I did career day with you, when I was a sophomore in high school, I wrote my paper on being a teacher. I'm about 100% sure of that. But it's interesting how life kind of comes full circle. I thought the way to get into teaching was to be a Spanish teacher, and that was kind of what I was thinking about doing. But I would say the biggest thing for high school students, and something that I wish somebody had told me back then, was you don't have to have it figured out. You don't have to graduate high school and know exactly what you want to do for a living. Everything will pan out like it's supposed to. Something will come along and you'll have your aha moment, and, you'll realize, oh, this is the career path. And don't be afraid to make that change. It took me a little bit of time and effort, but don't be afraid to make that change to get into a career that, you'll be happy in.
Right. Well, and I think you could have easily said to yourself, well, I've already put in 3 years. I'm just going to stick with it. But I like that you pursued what you felt was going to give you the most purpose, and now you still get to teach. So I think that is very, very cool how, like you said, that did come full circle. Abby, thank you very, very much. Very insightful. And I know there's a lot of people and students out there considering medical careers, and this will be very, very useful to them. So thank you, and good luck as you continue on your career journey.
Thank you.
Thank you for making the Joust About Careers podcast part of your day. I hope you learned valuable information from this career story. And to be sure you don't miss upcoming episodes, please click subscribe on YouTube or your favorite podcast platform so you'll know when the next episode is released. Thank you for spending a portion of your day with me. And as always, come back next week to learn even more just about careers.